Most of you know my journey because I've always told you that I have a gap of 6 years, 5 years, 5.5 years. So basically, when I joined your program, I was doing a clinic, and I think this program was a blessing for me because I did not know all the other ways of the wrong ways of doing things. So I started off my journey or journey of clinical experience through LGEM. So I was able to grasp the concepts from the lectures and apply them practically in my workplace as well. And luckily, the workplace, the first hospital I worked in, I was the only one in the ER. It was a new hospital, and they were only the MOs used to take care of the ER. So there was not any supervision. So any procedure, we did 100 emergency procedures over there at that time. So I tried to apply everything that I learned on the patients, and that really helped me in developing my skills. And then I also conducted many teaching sessions, and it is in that hospital that I did some audits and QIPs as well. Now coming to the interviews, that is something very important because I think many of you are struggling with that, and how LGEM has helped me with that. Basically, my CV really highlights the teachings that I've been doing, the 100 emergency medicine procedures, the procedures I've learned, the procedures now because I'm the trainer of the 100 EM procedure as well. So those are the basic highlights. Then thank you, Dr. Ash, for making me the director of AJKMC program. That is also a huge highlight for me in my CV as well. And the OSCE instructor. Now, all these things that were in my CV, they asked me about each of these. They asked me about my teaching. What do I teach? What level of teaching am I doing? Then they asked me about the topics that I've taught. And that is something you also have to write on your application when you submit your application on track jobs. And that is something very important. Then they asked me about this AJKMC program as well. They asked me about LGEM, and they knew the first interview, the one from which I got the offer. They knew Dr. Ash. When I told them about LGEM, they automatically said, "Okay, it's Dr. Ashfaq." I said, "Yes, it's Dr. Ashfaq." Uh, then they asked me about whatever LGEM has taught me. They were asking me about all those things. And believe me, the OSCE course, it was so helpful. All the questions they asked in the interview are your OSCE scenarios. All the questions they ask in the interview are what Dr. Ash has already taught. You know, the last 10 minutes blueprint that he gives of every topic. That is what your interview is all about. You just have to know, you just go through those topics in your through the portal, those last 10 minutes, and you will know how to attempt an interview. Just be yourself, be confident, because what LGM has given you, seriously, it will just polish your CV. Your CV is very difficult that a CV which has all these things in it, teaching experience and being the trainer and 100 emergency medicine procedure workshops and knowing those all those procedures. It is something that not all the people who are applying have on their CV. Another thing which I would like to highlight is the audits and QIPs. Dr. Ash has always told us that do audits on this topic, on that topic. So I did some audits as well. I just taught ECGs in my previous hospital. I carried an audit for that. Then I did a QIP for that. Similarly, I did around four or five QIP audits and QIPs. I just pasted the research council algorithms on in the hospital, and that was also a quality improvement program. And they asked me about each about all of those, and asked me to tell about a detail of one. So please try to do QIPs, try to do audit, at least do the first cycle, because that will really benefit you in securing a job. And secondly, Alhamdulillah, I got two job offers in the end, and I was really confused which one to take because the first one was of a very good hospital, and second one was a very lucrative kind of offer. Then a doctor asked Dr. Ash, which one shall I take? And obviously, whenever I have to make any decision regarding my career, I just message Dr. Ash, sir, please tell me what shall I do. He told me, take this one. Don't think about the other one. Then I accepted that one. But seriously, I believe this wouldn't have been possible without LGM. For me, it wouldn't have been. I couldn't have completed my MRCEM in 2 years. I couldn't have secured this job without LGM, without Dr. Ash's help, without the help of all the faculty members, Dr. Naila, Dr. Shom, Dr. Michael, all of them. They have been immensely helpful for wherever I am right now.